Well, welcome everybody. Thank you for being here and your interest in this. I hope that you take something away from this session today, something that's meaningful to you, hopefully something that's new to you. Please know that I am happy to entertain any questions. If there is a burning question that comes up or something that you need clarity on in the moment, feel free to drop that in the chat. And if there's a question that you want more discussion around, we can certainly do those towards the end. Today, I'm talking specifically about developing a plan for applied qualitative research. So I'll talk a little bit about what that is, but just to note that that I am an applied qualitative health researcher, and you might actually hear me say applied qualitative health a lot, just because that's the work I do, but this really is about applied qualitative research. So in the next hour, I'd like to talk about some of the key characteristics of these designs that are used in applied research, and then talk a little bit about the importance of congruence. This is something that's really important to me, and so I'd like to share that some of those ideas with you, as well as a framework that our team has developed. So a team with Susan Jack and some other really great qualitative researchers at McMaster University and Brock University. We've developed an EPPiC framework to help craft a really good qualitative research question, which absolutely helps. And then to look towards that design and what that might look like. So that's my goals for the next little bit. But certainly if there's other things that come up that you'd like to discuss, I'm open to that. Oops, wrong way. So I want to start by saying that qualitative and quantitative are absolutely equal. They are equal research designs. One's not better than the other, but they are different. And this comes from my colleague Susan Jack, but this is how she explains it so well. How we have here a game of football and what is known as football in the rest of the world, but what we know as soccer here. So football and soccer are two games that are played by teams. They use a ball, they're on a field. They're two similar games when you look at them from the outside, but they each have very specific rules. So if you played if you use the rules from football while you're playing soccer, you would get a penalty. You're not allowed to touch the ball. So each one of these games has their own specific rules, and qualitative and quantitative are very similar in that way. There's specific rules for quantitative, there's specific rules for qualitative. We just use the right tools and the right rules for the right game. So just to note that that these are just two different ways of getting to an answer to a research question. And my colleague Marilyn Ford Gilbo has this incredible paper about stories and numbers, and how sometimes numbers give us really good data, and sometimes we need those stories to work together together to inform what numbers we might need to get, and to contextualize numbers that are out there. So stories and numbers are both equally important. I also want to start, just as we get into this idea of what is applied qualitative research, I just want to start with looking at the roots of qualitative research. So qualitative research is steeped in traditions of philosophy, of sociology, and anthropology. And from those disciplines, we come to have these three big research traditions: phenomenology, grounded theory, and ethnography. And each one of those comes from a place of creating knowledge that helps us to philosophize about the world, to understand the processes the way that people work in society, or the way that cultural groups share beliefs and work through their traditions. So each of these traditions has lots of theoretical baggage, if you will, that comes with them. And each of them takes quite a long time, because they really are looking at how to get to the essence of an idea, how to develop a theory around why people do what they're doing, or to go and to be immersed in a culture. So lots of sociologists, anthropologists, and philosophers do this work for many years to get to the answers that they're seeking for their research questions. But in applied qualitative research, we tend not to have that much time. So I'm a nurse, and the research that I'm doing is about nursing, and it's very practical in how it's driven. So applied research, applied qualitative research tends to be more pragmatic, that it's very focused and looking at how that knowledge can be applied and how it can be applied in a timely manner. So for example, when you think about the COVID-19 pandemic, we didn't have time to look at how this might affect people over many years in health. So lots of other philosophers or ethnographers can do that. But in nursing, we needed to know, how do we deal right now with the high levels of burnout that nurses are experiencing? How do we deal right now with the discourse that was going on around vaccines or not to vaccinate? So we really need to get timely and practical knowledge out. Applied qualitative research often has some sort of immediate application to a problem, and it's also very flexible in the way that it's done. So we pull on those bigger traditions and identify how we can use the best methods possible to get credible, analyzable, and useful information out as quickly as possible, while still being very credible, because obviously we need that as well. And I do pull on health examples, but applied research might also work in many other fields where they are practice driven, or there is some sort of tangible outcome that we're looking for. Overall, the functions of applied qualitative research, and I would say that this largely is to qualitative research, is exploratory. So do we want to look at something that's new, so something that's novel, some sort of phenomenon that we just don't know it? We don't know enough about it yet to really do good quantitative research, because we don't even know what constructs, what we want to, or what we need to analyze. So sometimes doing those initial exploration into a phenomenon will give us some of that information that's needed. So if it's a brand new problem that's just come up, qualitative is often a good way to start. So to start with exploring, sometimes to explain. So to explain why something or how something is happening from a particular group of people, from their experiences, and to be able to document that. Or to describe. So often the work that we do is descriptive in nature. So we want to be able to describe a phenomenon that's going on. We want to be able to identify barriers and facilitators, to look at the perceptions that people are having, or the experiences that people are having towards a specific phenomenon. So where to start? And I think that the important part for applied research is to start with articulating the problem. So to identify the problem, and then to say, okay, is this a problem that requires an applied qualitative research method? And I don't know if any of you have ideas for what might be a problem that you're having in your research area. And if you do, please feel free to drop it into the chat box. But what are some problems that you're seeing in your field, in your area? And then to really think about, what is the best way to answer this question? So often our purpose statements will have stems, and this is a paper that I wrote with Moisey, and it has these stems of how we can start these purpose statements. So to describe the meaning of, to determine, to influence, to identify, to identify, document, to explain, to develop. So these are some ways that you might see a problem statement starting. And let me see where this, okay. Moving artists from poverty to purpose. Oh, what a great problem to address, Patty. Yeah, so if we were to take that and move that into a purpose statement, so we've got a really good purpose, and absolutely, I think this would be a great qualitative study to do, and an applied qualitative study, because obviously we want to address issues of poverty and in a timely manner. And I'm not saying that's the only way that you could do it, but from an applied perspective, it definitely, there definitely is a need for a timeliness of this. But if we were to change that, we might want to oh, poverty of heart, mind, and hand. Oh, you're so poetic, Patty. That's beautiful. But to understand why this is happening, to understand or to describe what this means to people that are living, even what this means, the poverty of heart, to describe that or to identify why this might be happening for a certain group, just different ways in which you can have these stems be there. I often think it's important too to realize that this is an iterative process. So you are first going to identify what the purpose is of it, and then from there, often then select a design. That design is going to impact how you're going to craft your question. But then when you craft your question, you might find, is this actually what I want? I mean, even Patty right there with how you added that poverty of heart, mind, and hand, it absolutely changes. It changes the meaning from poverty. And so does that make us really go back to redefine what the purpose is, or does that help us to identify just the addition of those few words? Does that help us to identify what might be an appropriate design from this? Because I know my mind is already changing what I initially would have thought might be a good design into even adding those couple of words, how that might change. Excellent. So just to note that this will be something that you go through a number of times to work through how these might change. And also, I think it's important to recognize that that depending on what your interest is going to affect the design, and that absolutely is going to change how you ask your questions. So I mentioned that methodological congruence is key. And this is something that's really important to me. It's something that just irks me whenever I'm reviewing papers. I always want to make sure that there is alignment between what the study of the purpose is. So again, if you're saying that this is a qualitative study or an applied qualitative study, are you planning to describe, explore, explain, or maybe even evaluate? So is the purpose clear, and is the purpose aligned with qualitative mandates? And then does your research question correspond that way. And we often talk about coded language. I'll share some of that in a moment, but does the language that you use, does that make sense within a qualitative tradition? And oftentimes the language that you use in your question cues me to know what kind of design you're about to use. And that should be in alignment with the study purpose and the question and then the design. So from that question, selecting a design that allows you to answer the question in a way that is meaningful, and then to make sure that the sampling strategies that you use also go along with the way that the design that you're using. We talk about data generation strategies. This is previously known as data collection strategies. We like the term data generation better because in data generation, it tends to note that this is data that we're generating together with participants, and it's not just something that happens to be out there in the world, in the ether, that you can just collect. This is something that you are creating or co-creating together with your participants. So absolutely, the researcher has lots to do with that. And then finally, that your analysis strategies, your analysis strategy should be informed by the rules of the design that you've chosen. And again, we talk about the rhetoric, the language that we use, and that should also be something that is considered within your analytic plan. So I said I would discuss some of the applied qualitative designs, and I'll share a few of them. Again, not to note that the traditions, the bigger traditions that I mentioned earlier, grounded theory, phenomenology, and ethnography, these are absolutely the roots of qualitative research, and they have often informed some of these other designs that I'm talking about. But they often take many, many years to do those studies, and again, often are rooted in those, or ought to be rooted, I think, in those traditions of philosophy, ethnography, and sociology. So some of these take those parts of those traditions and inform these specific methodologies. And some of these include descriptive or qualitative descriptive, as it's known, and Sandalowski is one of the biggest researchers in that area. A qualitative descriptive study often looks at describing, so stays at that everything has interpretation, but it stays closer to the data in terms of how far the analysis goes. It helps to describe an experience, processes, perceptions, and we often find that these are the studies that want to identify barriers or facilitators. So if you're looking to identify barriers and facilitators, this is a great choice for what you might want to do. Also, to look at how a specific group might want to recommend changes to something. So for example, if you wanted to know what changes a particular group of people might like to perhaps a social support group, and you wanted to evaluate it and look at what changes or recommendations they have, this would be a fantastic method to use. Case study research. First, I need to say this just in case there are other health researchers out there, but case study is not case study in maybe a more traditional kind of way. Whenever I hear the word case study as a nurse, I often think of it as a case that we're unpacking. I recently watched the television show House, and they often have a case that they're solving, and they learn everything about one person and what that means. That is not what case study is in this realm, and I will go into it a little bit more towards the end. But case study is an actual particular methodology that is exploring a phenomenon, and a phenomenon that sits within a particular context. So, for example, at Sick Kids Hospital, they have a very interesting way of treating sickle cell anemia. on their unit. And that is a case within a context. So we can't look at how that works outside of that context. So we might like to look at case study, or another option would be, and that is a single site case study, but there could be multiple sites that happens. So for example, Aaron Ziegler at TMU did an incredible case study around gender affirming care. And so looked at gender affirming care clinics in Ontario, many of them, and then really delved into all sorts of aspects. And it's a big study. It looks at lots of different information. It also tends to pull in some quantitative work, so some numbers to inform what's happening, and also to really describe everything that's happening from everybody's experience. So in the gender affirming care study, she talked to physicians, nurses, nurse practitioners, to people that answered phones at the front desk. So everybody that was involved, to the patients. So everybody that was involved in those gender affirming cares at multiple sites, they were all interviewed. Interpretive description is another methodology. This is I'm completely biased. This is absolutely my favorite, perhaps because I'm a nurse. And this looks specifically at disciplinary knowledge. So it is by a nurse, Sally Thorne, who really wanted to look at how do we pull from these big traditions, which she was trained in, and how do we do really good research that is applied to what we're doing. So recognizing that as a practitioner, we have a certain amount of disciplinary logic that helps us to understand a phenomenon. And this, although she's a nurse, it's not specific to nursing, but it does require a disciplinary knowledge. So are you for example, are you a police officer, a teacher? Are you a lawyer? Is there some sort of discipline that you come at this with? And you would need somebody on your team, or many people on your team, to have that, so that you can come to understand and really look at these problems from that perspective, from the perspective of how do I as a nurse inform this study? And it really leans in heavy onto the understanding that the researcher brings to this. There's just a certain way in which I can do this work because of my discipline. So the same way that I wouldn't be able to go into education and do this type of work because a teacher would understand it differently than I would as a nurse. So interpretive description is a really great way to look at applied research, particularly if you have a disciplinary background. Okay, let me have a quick drink. And I'm going to move on to crafting your question. So we were teaching qualitative research at the graduate level and noticing the struggles that many students were having with crafting qualitative research questions. And if you don't craft a good research question, it's difficult to have a good research proposal. So we came up with the elements that we believe help you to create a good question, and we call it the EPPiC framework. So so these are the elements of it: the emphasis of the question, the purposeful sample that you're using, the phenomenon that you want to explore, and the context in which it comes. And then whenever you put these all together, hopefully you have a good question. So just to start, I know I said that I am talking more about these bottom four are definitely applied qualitative research. The first ones aren't, but I have them in here anyway, just to show you the emphasis. So the emphasis is the coded language that I'm talking about. So if you were to do a grounded theory study, you are really looking at trying to understand the way in which a certain process is experienced in the world, and to build a theory. So oftentimes we'll see the beginning of the questions worded in these ways. What is the basic social psychological problem? What is the basic process to, or what is the process of? And gerunds, if you're not familiar with the word, is essentially an ing word. So what is the process of letting go after, or accepting after, the diagnosis of a chronic condition? What is the process of letting go after an experience of grief? So the gerund is the ing word in that case. But if we're looking at, if you're doing a grounded theory study, I would expect there to be some sort of language that keys me in this way. The same way that if you're using language like what is the lived experience, I am absolutely expecting that you are probably doing a descriptive phenomenology study. And this is really interesting because I think the lived experience has just come to be every qualitative study. And it really irks me because the lived experience means something very specific to phenomenologists. And so to be true to that language, that's what I would be expected. The same way that if you were to do an interpretive phenomenology study, I would expect what is the meaning of, or what is the essence of, and probably what is the essence of some sort of shared human experience. So what is the meaning of grief to someone who has recently experienced a specific loss? What is the meaning of acceptance for somebody that has had a diagnosis of a chronic condition? So you can see how those two examples, I could frame them as a grounded theory, or I could frame them as a phenomenology study. Focused ethnography I didn't talk about yet, but it's similar to ethnography, and I'm not sure if it's forward in my slides or not, so I'll just mention it here. But focused ethnography is very specific, is more specific and time bound than an ethnography study would be. So normally ethnography studies, you might go into a particular area. My colleague Allison Hamilton went for years, literally for 2 years, into the Caribbean to go and live there while she was doing her PhD study. But I don't have time as a nurse to do that. A focused ethnography allows a shorter time period with maybe much less observation, but some observation. And I would expect to see something like, what are the shared values, beliefs, or practice patterns, one of those types of words, for blah, blah, blah. Interpretive description. So again, this is the one that looks at disciplinary knowledge. In what ways do explain their experiences with an issue, or within a context? So in what ways do, oftentimes Sally Thorne talks about what can be learned from. So those are the types of ways in which that coded language happens. Fundamental or qualitative description. What factors influence? What are the barriers and facilitators? Those are often what we'll see. And then again, I just talked about case study, but and then the sample that you're looking at to decide whether or not to, what factors influence their decision, how do the sample attending the context describe their experiences. So how do parents of a child diagnosed with sickle cell anemia attending the sick kids clinic describe their experiences following diagnosis or following treatment? So these are some of the ways in which design language or coded language help to identify your question. The purposeful sample looks at who needs to be involved, who are the right people who's willing to participate, and are they able to participate? And if they aren't able to participate, why not? And how can you adjust your study in a way so that the right people can participate? Because we do want to make sure that the right people are being asked at the right time and in the right way. And what other perspectives might help to identify? I shared Erin Ziegler's study in which even the front staff people have an impact on gender affirming care. And so that was really important to her study as well. Are there other professionals that should be involved? Are there policymakers that should be involved? And or even is there an organizational perspective that might help? Should any of these researchers or should any of these people be actually co-researchers? Is that appropriate for your design? And are there any other items? So policy forms, information documents, and charts. And I think that this is very specific to applied qualitative research, that we really do want to have a broad net to be able to pull from. And the next one is around the phenomenon of interest. So to be able to make sure that your sample is knowledgeable. So the people you're asking, are they knowledgeable about whatever it is that you're interested in? So, so if it was processes, you might want to look at the decision to wear a mask. Or if there was an event, it could be a disease, a program, a service that you're looking at. And so it could be something like implementing a hospital campaign around using masks. Also looking at your context. So the context is also important to include in your research question. And the context might be something geographical, but it doesn't have to be. So it could also be something organizational, like a unit, a particular organization. It might even be a developmental time. So during pregnancy, during adolescence, during menopause. It could be something that's social. The context could be something that happened during the time of COVID, so during the pandemic, post-pandemic time, colonial, post-colonial. And the time that you're using could vary, and it could be the context as well. Could be a season, it could be a night shift. It really depends, but you do want to be very clear about what the context is. And then from there, we can build these questions. So here's some examples of questions that we've built. And this first one was a qualitative description. What factors, and these are color coded. So if you look at the coding on the top, you can see what are the factors that influence. Is our coded language, surgical, oncology, residents, is our population, decisions to wear a mask while consulting newly diagnosed women with stage 3 breast cancer is our phenomenon, and following the end of mask mandates in Northern Italy. So that is our context. And we actually have two contexts. We probably could have left it with the end of mask mandates, but adding the actual geographical space also just made it clearer. An interpretive description might be, in what ways do postmenopausal women with breast cancer explain their varied experiences in implementing strategies to prevent the acquisition of respiratory infections while receiving chemotherapy in an Ontario Cancer Center. And we didn't do the context, but here the context would be Ontario Cancer Center. A focused ethnography. So again, we have the context here at the beginning of the question, the regional centers, and then how do the values, beliefs, experiences. And again, we include the population as well as the phenomenon of influencing the adoption and utilization of infection mitigation strategies. And finally, there's a case study suggestion. And case studies, again, often start with how questions and are looking at something very specific within a case. So hospital administrators and clinical leaders was our population, and mandatory masking policy re-implemented within the Hamilton Health Center Health Sciences during fall of 2023. So again, I'm just going to quickly show some examples of these designs, but interpretive description. So describing, interpreting various patterns, grounded in our clinical practice or in our disciplinary knowledge, and using that disciplinary lens is very, very important. In terms of how that design might look like, it's very purposeful, looking at a very particular population that you want to use. You might use words like theoretical or maximum variation sampling, so that you get a wide net of who is included. There's a range of data generation strategies because, as I mentioned, this is informed by all three traditions. And so, depending on what's appropriate, there are lots of different ways to collect the data and also to look at it and now analyzing it. Qualitative description, again, really looking at creating the richest description that we can of a particular problem, and then looking at staying close to the data. So not putting in too much interpretation, but obviously there's some interpretation when we're taking a group of people and putting together and summarizing or condensing that. And oftentimes we see content or thematic analysis. Oops. Focused ethnography. Again, like I mentioned, this is often more limited in the number of participants, and rather than going into as like a full ethnography might, rather than going in and becoming immersed in a community, you might do some episodic participation or observation. So if, for example, you wanted to understand more about an emergency department and how they are enacting particular policies, you might want to go in for a night shift one day and go in another day for an afternoon and another day for a day shift. So there might be less observation and for shorter periods of time. And I mentioned case study again. I think that the best, hands down, the best reference for this is Baxter and Jack. It's here on the screen. They have an article that goes through a step-by-step of how to produce a case study. I actually think it's a case study proposal. And there's different ways that you can do case study. Yin is one of the case study designs that you can use. It is far more post-positivist in how it collects data, and including that they often look at quantitative measures as well within that design. And then Stake and Miriam are also two other ones that are often used as well. That brings me to the end of my presentation portion. So I'm going to stop there, and you see Kim is off mute. So I think we're going to open it up to some questions.
I was just going to thank you, Karen, for that presentation, and hopefully now everyone is feeling a bit more confident on developing a plan for conducting applied qualitative research. I will just momentarily stop the recording, and then we'll open it up to everyone's questions and a more general discussion.